The Ministry of Health will convene a meeting on Monday with its technical advisory group to discuss the decision by the WHO to recommend a reduced dose of the Pfizer vaccine for children 5 to 11 years of age. Health Minister Terrence Deyalsingh says discussions will now take place with all stakeholders involved to work out when and how this will be rolled out. Sunil Lalla reports.
Says they will deliberate on the WHO's updated guidelines with regards to the use of the Pfizer vaccine for children 5 years and up. On Friday, the WHO recommended extending the use of a reduced dosage of the vaccine for children 5 to 11 years old. Mr. Deyalsingh says a number of issues have to be discussed, including whether the current vaccines could be administered to the age group, since some of the previous recommendations have changed.
The dose was going to be different, the buffer was going to be different, and the packaging may have been different. What we have to do with this update that WHO put out yesterday is to see if it speaks to that, or it speaks to the fact that the current vaccines we have can be used by changing the dosage as said in the release.
He says several stakeholders also need to be consulted before a decision is taken to approve the vaccine locally.
We have made numerous calls to all of these bodies, PAHO, CARFA, the local doctors, Pediatric Society, Tobago Regional Health Authority, Ministry of Education. And once we have a position, we will come to the national population to discuss the national rollout.
On the issue of vaccine hesitancy, Mr. Deyalsingh says vaccines for children are nothing new.
As parents, they have been vaccinating their children and babies from 2 months old. Every parent in this country has vaccinated their children from 2 months old.
Epidemiologist Dr. Avery Hines continues to implore all those who could get vaccinated to do so, pointing out that no age group has been spared from the effects of COVID-19. Sunil Lalla, TTD News.